So welcome, David. It's just wonderful to have you here.
My pleasure.
I've been doing the Brainspotting trains for a few years now in the UK, and it's really starting to take off. Getting more and more therapists training here. It's a real excitement, which has been lovely for me as the trainer here. So you've been kind of bit by bit bringing Brainspotting to so many different countries. I've lost count of where we're at now.
Over 60.
Over 60 countries, yeah. And I know numbers as well are always building of those that have been trained. Again, do you know where we are in terms of?
We're over 13,000
right.
internationally. We have 65 trainers around the world.
Wow.
That's a lot of people, 65 people.
Yeah, that's fantastic.
You put them all in one room, if it's not that big, you'll see it's a crowd.
Yeah, that's huge. And a lot of people are very curious about Brainspotting because I think it's quite exciting. What kind of the way people talk about it, and it's kind of got a freshness and a difference to other therapies. So, how would you describe Brainspotting? Yeah.
Well, first of all, for people who haven't been trained in Brainspotting or really don't have much exposure to it, it's really important to know that it's an integrative modality. In other words, it doesn't matter what background you come from, all the way from psychoanalysis to CBT to Gestalt, bioenergetics, whatever it is, there's a place for you with Brainspotting because it is fully integratable into whatever you've been doing. It is a relational therapy. That's also a brain-body mindfulness-based therapy. And in particular, we are attuned to and we observe the visual field, where people look in relation to what they feel, and also when a person is activated, different reflexes that pop up in different eye positions, and really eye positions where people get the access to whatever it is that is troubling them the most.
I see. Yeah. So with eye positions, and I think to different people, the idea of eye positions might mean many different things, but when we're talking about eye positions in Brainspotting, how would you describe it? In what way we're using the eyes?
The retinas are actually made up of neuronal tissue. So literally, when information comes into the eyes and hits the retinas, it's not just visual at that point, it's neurological. That's how bound up together the visual and the neurological systems and processes are. But in psychotherapy, we're always trying to get access to whatever it is that the person is carrying. And we now know that with understanding the brain in more depth, that the neocortex for conscious awareness and thought and languages is really not where trauma is or that which generates the symptoms that people bring to psychotherapy. So when Brainspotting, we use the visual field to get specific focused access to the systems that are holding that which generates the anxiety, depression, or other trauma symptoms. But once we find it, we hold it in place. Once you find those hot spots, we call them brain spots, that just really resonate, and the person continues to look at it and is mindfully aware of what goes on inside of themselves. There's a very focused processing in the deep neurobiology in a way that can't happen through talking, and a way that can't happen without the focus that comes through the visual system.
I see. And is this where the use of the pointer might come in, for example?
Well, we do use a pointer, both to explore the visual field and to hold the awareness on it, because if you try to do that with your finger for more than 3 minutes, you become very uncomfortable and fatigued.
Yeah, I see. And then once you've found an eye position and maybe holding it, using a pointer, the client will be invited to stay on that position there, to use that rather than...
They're guided to.
Guided.
Yeah.
That sounds like an important word in Brainspotting.
Yeah.
I was just going to say, is that where earlier you said the importance of the relational aspect?
Brainspotting is an attunement-based therapy. We are by no means the only attunement-based therapy. In fact, every effective therapy is attunement-based one way or another. But for us, the attunement is both the relational attunement and the neurobiological attunement. But it's the relational attunement that comes first. What do we mean when we say relational attunement? It means that we're sitting there with the other person, we're present with the other person, but but we are completely open to where they are, what they bring, and where they go. And we have no presuppositions about what it is. That comes out of what we call our uncertainty principle. That the client sitting in front of us as the brain spotting therapist has a neural system that's comprised of 1 to 4 quadrillion connections. Right. A quadrillion is a billion multiplied by a million. Ipso facto uncertainty, with a system that's infinitely vast and complex, you really can't know what's going on inside of a person. You can't know what brought them there, and you can't even know where they go. So they say, well, then what can you do? Well, in the context of that uncertainty, you hold this dual attunement frame, the relational frame, which is focused and contained by the neurobiological frame with body awareness and awareness of the visual systems. And inside of this frame, the system's capacity to find its way, to adapt, to re-regulate, just naturally takes over. And for some people, it happens very quickly. For some people, it takes a lot longer based on the complexity and of what they're carrying and what their history is.
Wow. I mean, considering all those complexities, I just wonder if a lot of therapists that are new to Brainspotting feel overwhelmed by these approaches, the neurobiological, the sense of really this heightened attunement. Do you find?
Well, there's a lot to learn. And with anything of substance, there's a lot to learn. But it all makes sense. It's all organic. And it all fits with what we already know. It just gives us a way to understand it in an organized way and then to apply that organized understanding.
I see. And after a training, say someone comes for a Brainspotting phase 1 training, which is over 3 days. How ready would they be after a phase 1 training to start to use Brainspotting in their practice?
The person comes out of phase 1 with the basic tools that they're able to apply right away. And the basic tools are relatively simple. What happens in the context of those tools is what's complex. One of the challenges for a new Brainspotting therapist is that we have been usually taught a certain way of doing things, which is that you have to take a certain kind of history to get a certain kind of diagnosis to form a certain kind of treatment plan, which implies that we can know what we can't possibly know. Now, all those things are important aspects of a clinician's toolkit, but at the same time, when you come in with Brainspotting, you're coming in with much more of a sense of uncertainty and openness. And the biggest challenge for the new Brainspotting therapist is to stay out of the way, and to not form suppositions or presuppositions about what's happening or why it's happening, but to really sort of clear themselves out and follow the client wherever they go. We use the metaphor of the comet, where the client is the head of the comet and the therapist tries to get into the tail of the comet to follow the client wherever they go.
Right. I wonder if that would be quite scary for some therapists to follow a client who may have all sorts of complex needs.
Well, what's the alternative? To not follow the client? It's actually scarier to not follow the client, because then you don't have a handle on what's possibly happening.
Which kind of brings to mind a question people ask: well, if you're following a client, will they feel safe enough? Will they feel resourced enough? And if so, how? Those kind of questions. Right?
The client who is listened to, the client who's believed, and in that sense, the client who's followed, feels a sense of, we'll use the word safety, that they wouldn't feel if the therapist wasn't sitting with them in that way. But what we teach in Brainspotting is that the most powerful healing agent of the process is the attuned presence of the therapist with the client. And when you know that, and when you keep on renewing that notion, it actually heightens or deepens the power of your attuned presence. And when you sit with a client with attuned presence, they're having an experience that they have rarely had before, perhaps never had before. And it feels grounding, it feels containing, it feels resourcing, without having to do any specific resource techniques, which are also part of Brainspotting. That's the attuned presence relationship is the ultimate resource for the human being, and especially a human being struggling.
Right. And I suppose in doing that, in that enhanced attunement, one could be in the process to live in a session with the client, be repairing some of those attachment wounds.
Mm-hmm.
Yeah.
Not by trying, but by holding the space and the person's capacity to repair it internally, somatically, subcortically on their own.
Uh-huh. Not by trying, that's an interesting phrase. So is there something about the therapist's expectation being different in this process?
Well, trying is neocortical.
Right.
Trying is conscious, it's intentional.
Mm.
The subcortex doesn't try. The subcortex just is and does. And it's intuitive. It knows what to do.
So you trust in the subcortex knowing what to do. And it is a lot of approaches now, more and more, I think you hear approaches talking about embodiment, really kind of understanding the physical process, psychological, emotional healing. Is this connected?
We don't separate out the body processes from the psychological processes or the brain from the mind.
Uh-huh.
To us, it's part of a vast integrated system. And the deeper you enter into that system with the person, the greater capacity there is for healing. Information flows from the deepest parts of the system up to the more conscious parts of the system. Very little flows in the opposite direction.
Right. Yeah.
So if you're sitting with a person and they're looking at a pointer and they're aware of what they're feeling in their body and they're mindfully following it, and you're just sitting with them, patient, present, and so on, the system just takes over what it knows how to do from the deepest levels. And if you tried to make that happen, you could never make that happen.
Mm-hmm. And clients sometimes have tried everything and really worked really hard and maybe feeling very powerful issues that may manifest physically, with physical manifestations. Could brainspotting be a way in or useful?
Of course. Of course. I mean, that's what we are present with, mindfully present with. And
I think as well, more and more I'm aware that people are there's a new wave, I think, of interest in how we can work with parts. Is that something as well that's integrated in brainspotting parts?
Again, brainspotting can be integrated and is integrated into all the other modalities. And parts work has become a modality unto itself under the umbrella of dissociation. And brainspotting has its own way of uniquely working with parts, which has to do not only with finding the part or bringing the part out, but really the position of the part. Because when a part comes out, whether it's spontaneously or a part is called out, the part is always someplace in the room. And if you actually guide the client to look at that part, there is a relevance to that position in the context of that part.
So the client will be kind of recognizing or noticing a part and being able to almost look out at it to work with it. Oh, I see. Yeah.
But again, not by trying it, but by setting it, holding it, and then watching it happen.
So these are lovely ideas. I think to the new watcher or listener, they may be intriguing, but also open up lots of curiosity. So there's ways to train in brainspotting phase 1, phase 2, and phase 3, and then there's advanced classes around that. And the kind of the seminal text that you wrote is just to remind us what the book's called for those who want to go and look it up.
Yeah, Brainspotting, the revolutionary new therapy for rapid and effective change.
Yeah.
I'm glad I remembered that.